Are you ready to bid farewell to knee pain with knee replacement surgery? You are right. When medications and lifestyle adjustments fail to treat arthritis, injury, or age-related knee issues, this surgical procedure comes to the rescue. During knee replacement surgery, the damaged knee joint is replaced with artificial implants, offering pain relief and restoring your ability to move freely. Here is how it is done. First, a small incision about 8 to 10 inches is made on the knee. The thigh muscles and the kneecap are moved aside to access the joint. The worn-out bone and cartilage are then removed using specialized devices. Then, the artificial knee joint is securely placed in position. Finally, an X-ray is taken to ensure a perfect fit before closing the incision. After a knee replacement, you can start walking with the help of a walker or crutches to support your newly placed joint. You will slowly learn to use your new joint with the help of physiotherapy and exercise, and finally, you can walk like before. Hope this was helpful. Follow eHealthy Info for more information like this.